Hi, in this video let's discuss the following topics, starting with palatal lift processes, which you mentioned in one of the previous videos comments. So as you can see, this is a palatal lift processes, which is a special appliance first advocated by Gibbons and Bloomer and useful for patients with palatopharyngeal incompetence resulting from compromised motor control of soft palate and related musculature, as seen in conditions like myasthenia gravis, cerebrovascular accidents, traumatic brain injuries, cerebral palsy, or injuries to soft palate and cleft palate, etc. The appliance is used with the objective of displacing the soft palate to the level of normal palatal elevation, enabling closure by pharyngeal wall action. Right? Now let's move on to the next question. Furcation probe, Neighbor's probe, as you're all familiar with. So you can find the Neighbor's probe here. So in multi-rooted teeth, the possibility of furcation involvement should be carefully explored. The use of specially designed probes such as Neighbor's probe allows an easier and more accurate exploration of horizontal component of furcation lesions. Consider this very important. And as you can see, curved Neighbor's probe, number 2 Neighbor's probe for detection of furcation areas with color-coded markings at 3, 6, 9 and 12 mm. Right? Now let's move on to the next question. Treatment of apical third fracture. If there is apical third fracture of root, what would be the line of management? Was there a question on the same? Do let me know. Anyways, here is some literature pertaining to it. So as you can see, this represents apical third root fracture in case of maxillary central incisor. As a thumb rule, the prognosis of root fracture depends on location of fracture. The more apical the fracture, the better the prognosis. So, if the fracture is an apical third of root, the prognosis is favorable provided the tooth is immobilized and not placed under pressure of mastication. The opposing tooth or teeth should be ground to minimize incisal occlusal stress. A tooth with its root fractured in its apical third has an excellent prognosis because the pulp in the apical fragment usually remains vital and the tooth may remain firm in its socket. A mobile tooth should be splinted. However, if the pulp in the kernel fragment remains vital and the tooth is stable with or without ligation, then no additional treatment is indicated. In the event of pulpal death in the kernel fragment, endodontic treatment can be done, which is preferably limited to kernel fragment. If the tooth fails to recover, the apical root fragment can be removed surgically. Right? This is a line of management if at all there is fracture in the apical third of the root. Now moving on to the next topic, lateral luxation line of management. What if a tooth is displaced labially? How do you manage it? So as you can see, lateral luxation, it's defined as an eccentric displacement of tooth other than in axial direction. Treatment comprises repositioning of tooth back to its normal position. This is difficult and painful and has to be done with help of forceps under infraorbital regional block anesthesia. And these teeth have to be stabilized with a flexible splint for a period of 3 weeks. Longer fixation periods are recommended in cases of marginal bone breakdown. Right? Now moving on to the next question, flea-bitten kidney. So let's review some literature pertaining to the same along with the image. So as you can see, effects of hypertension include nephrosclerosis, that is affecting kidney, hypertensive heart disease, hypertensive retinopathy and intracranial hemorrhage. So in case of malignant nephrosclerosis, you can find grossly the appearance of the kidney varies. In case of malignant hypertension superimposed on pre-existing benign nephrosclerosis, the kidneys are small in size, shrunken and reduced in weight and have finely granular surface. However, the kidneys of a patient who develops malignant hypertension in pure form are enlarged, edematous and have petechial hemorrhages on the surface, producing the so-called flea-bitten appearance. And also the cut surface shows red and yellow mottled appearance. Right? I hope it's clear. Now moving on to the next question, biomarkers in drinking. So there are several biomarkers to assess heavy drinking. You can find them here. See if any of them is useful for you, and if you need any additional information, do let me know. right? Now moving on to the next question, treatment or line of management of giant cell arteritis. Prednisolone, as most of you mentioned in the comments previously. So for sake of reviewing and completing it in the paper discussion videos, I've incorporated the same. So as you can see, giant cell arteritis, so it's also called as temporal arteritis or cranial arteritis, even though the terms are misleading. So giant cell arteritis is a vasculitis affecting medium and large vessels with a predilection for the aorta and its branches. The term giant cell arteritis is often used interchangeably with temporal arteritis and cranial arteritis, but these terms are misleading. Although GCA usually involves the superficial temporal artery and other extracranial branches of carotid, the disease also frequently affects the aorta and its large branches and is by no means confined to head. It is sensitive to corticosteroid mediated immunosuppression. So oral prednisone is the first line acute therapy for GCA, right? And you can find the dosages in the following literature. Now let's move on to the next question. There seems to be a question on operant conditioning. So let's review some literature pertaining to the same. So Skinner described 4 basic types of operant conditioning distinguished by the type of consequences. Positive reinforcement. Example, a child rewarded for a good behavior following dental treatment, right? That falls under positive reinforcement. Whereas negative reinforcement, if the parent gives into temper tantrums thrown by the child, he is obviously reinforcing that negative behavior, which is negative reinforcement. Then what is omission? If the child misbehaves during the dental procedure, his favorite toy is taken away for a short time, resulting in omission of undesirable behavior. And finally, punishment involves introduction of an aversive stimulus into a situation to decrease the undesirable behavior. Example, using a palatal rake in correcting tongue thrusting habit. Right? So this is some information pertaining to operant conditioning. Now moving on to the next question, infection spread from maxilla or from vestibular area to infraorbital area through which muscle? So those are the keywords which I received, and let's review some literature pertaining to the same. The vestibular space primarily contains areolar connective tissue, but it's crossed by parotid duct and long buccal and mental nerves. Also, you can find that vestibular infections can pass around the levator anguli oris muscle to enter the infraorbital space, or between the buccinator and depressor angular oris to enter subcutaneous or buccal space. See if this information is helpful in answering your question. If necessary, we'll update additional information in the description part of the video. Do let me know in the comment section. Now moving on to the final topic in this video, M-spike. So there seems to be a question on M-spike related to multiple myeloma. So what is this M-spike? So as you can see, malignant plasma cells, they secrete an antibody or immunoglobulin called M protein or M-spike, or also called as paraprotein or myeloma protein. So these can be detected in blood and or urine of most myeloma patients. So as you know, in multiple myeloma, malignant plasma cell makes a clone of itself, and these malignant plasma cells or myeloma cells accumulate in bone marrow. So these are some of the topics which I wanted to highlight in this specific video. So if you need any additional information, do let me know. We'll update that according in the description part of the video. Also, if you have any additional keywords or key points pertaining to question paper, drop the comments. We'll update them and we'll review those questions in the coming videos possible. I hope it's clear. Wish you all the best. Love you all.